Oh, what the? Disastrous eye pokes, crushing falls, and hook, line, and sinker. In honor of the new film coming out today, we're heading to the Blackwood Mountain, breaking down and reacting to the most horrifying medical scenes and survival injuries from the Until Dawn video game. Let's dive right in. Oh, this is, what the? Immediate splatter of the red stuff everywhere. Could that happen? I guess if you hit like a major vessel. Initially on your abdominal wall, you're cutting through that skin and then subcutaneous layers. That layer has some blood vessels there, but not like major ones. You're also gonna get probably regular fluids. If it's low down in the pelvis there, maybe the bladder is gonna be hit and you're gonna get urine. Oh my gosh. Will it actually make you succumb to the injury as fast as they're having here? Depends if the aorta and the inferior vena cava are injured and hit. Those are your major artery and your major vein. If those are hoses that are open, you're gonna lose blood so fast that you're gonna pass out in 30 seconds to a minute. If you continue to just bleed out, then you're not gonna make it past probably that minute. The flamethrower guy. Oh no. Falls from great heights. This is a fall from a great height. Anything greater than 5 meters basically is characterized as a major trauma. It doesn't mean major trauma has occurred. It just means your suspicion is very high relating to, oh gosh, a mechanism of injury can lead to significant amount of damage to the body. Oh! Snapping the back. I've seen injuries where people fall out of trees or off of roofs and they land on uneven surfaces and snap their vertebral column, which then cuts through the spinal cord. I've seen people get paralyzed from the level down where that injury is. But if it's high enough up, it can cause issue relating to your airway. Whoa. Oh, what the? Just ripped off the mandible. The mandible is the jaw, and the jaw is connected here at the hinge point here. So people sometimes will get something called TMJ, so inflammation of this hinge joint. Sometimes people can get it dislocated, and then you have a lot of strong muscles on the inside. So you have a lot of this normal skin and connective tissue holding it in. Whoa. Whoa, come on. Come on! Look at those gnarly teeth. There are no molars. These are all pretty much like canines. We have incisors, canines, and molars, premolars as well. Those are all different types of teeth. It looks like the eyeballs are looking up. When I have patients try to look up, they do not look up this far, and you don't see that part of the eye. Yes, you see the whites of the eye, but these are pretty intense. Oh, geez. Oh, look at those nails. Holy cow. Please, somebody cut those fingernails. We'll have patients come in who actually need a tool to cut their fingernails or their toenails because they've just had so much buildup of the nail itself, and sometimes there's fungus and they get even thicker. We like to send them to the podiatrist, but make sure hygiene, you clean these and you cut your nails. Oh! What the hell? My gosh. Enucleated, so popping through the eyeballs. That is crazy. The eyeball is mostly fluid. Yes, there are blood vessels within the eye, but it's mostly fluid. The nails are long enough. If they are strong enough, they can puncture through the posterior wall of the eye socket and go into the brain. The back of the eye socket has your muscles of the eye as well as the optic nerve, which has your major blood vessels going through there as well. So there could be some decent amount of bleeding in there, but not like a fountain where it's just bleeding, 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 bleeding. If it goes far enough, you're getting more midbrain. It could puncture into major functioning areas, have to do with major functions of our body, versus if it's just frontal lobe, it's not really hitting areas that are vital to the basics of survival and living. Oh, it was so bad that it took his head off. We've talked about it before. Eye movements might happen, muscle function, even though the head is amputated. There are action potentials that are still going on that will move muscle. It could also move the muscles of the eye, which then can make the eyeball look like they're moving, but they're not going to consciously like be blinking and looking at you and following a direct pattern. It'll be random. Random! Darn. What? Single gunshot wound, left eye, shooting directly into this area. As I said earlier, potentially the major structures in the midbrain are going to be injured versus hitting higher up. With that trauma, increases the risk of brain swelling, bleeding in the brain. It could eventually cause major problems, but all depends on where it hits. I've had many cases where people are shot in the head and they survive. Oh, let me just take my face off. That is a massive iris, small pupils. Could you actually pull your own skin of your face off? That would hurt a lot. But I've seen people who get avulsed injuries where the skin does flap off, but it's usually quite thick.
Pretty thick.
Tissue is not just the skin, it's also the subcutaneous tissue as well. And that's why we're seeing it like this, where there's blood vessels and the musculature, but you don't see any fat there. It's just because it's sticking to the skin. Oh! Oh, what? Survivable injury, but it depends how long you're hanging up there. Soft tissue right through, didn't even hit the bone probably, and right out the mouth. So being pulled and held by your jaw is probably not comfortable and increases the risk of it actually being broken or dislocated and pulled off and causing significant pain. If you can get yourself off there and treated with antibiotics and sutured, you'll be okay. Gonna leap. Oh geez. Oh man. Watching these hair-raising moments in Until Dawn reminds me, life's occasional stress can hit unexpectedly. That's where Chillax by my company, Life Happens, comes into play. Check out Chillax at lifehappens.com or on Amazon. Jump. Woo. Oh my gosh. Seriously? Goodbye. That is awful.
That's awful.
Could this be survivable? Maybe, but the issue is the minute you take this individual out of this apparatus, blood's gonna open up and pool out and you're potentially going to bleed to death and go into cardiac arrest. Cardiac arrest! The lower legs are mangled and destroyed. Could you live without those? Yes, you'd have to amputate those off, and you'd want to because of the destroyed tissue, increased risk of infection. The face is just smashed off. But I will say, this is just superficial. Well, relatively superficial. But it's all the front part of the face. If the brain is still intact, and you can protect the airway by putting a breathing tube in the hole that's bubbling, you might be able to use suction, get the blood out of the way, and put the tube through the vocal cords. And if you can't, then you can actually just cut open the neck and put a breathing tube through the cartilage of your upper airway. Are you planning to see the new movie of Until Dawn? Let me know in the comment. If you guys enjoyed this, definitely check out this playlist right here. Make sure you binge watch everything. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.